While chemotherapy and surgery are currently the standard treatment options for mesothelioma, there are also some alternative treatments that some patients may choose to explore as a possible complement to traditional therapy or for improving quality of life. It's important to note that there is generally limited research on the effectiveness of alternative treatments for mesothelioma specifically. Patients should always discuss any complementary therapies with their doctor to understand potential risks or drug interactions. Nutritional therapies and dietary changes are popular alternative treatment approaches for many cancer types. For mesothelioma, focusing on an anti-inflammatory, antioxidant-rich whole foods diet may help patients feel better and boost the immune system's ability to fight the cancer. Foods like brightly colored vegetables and fruits, nuts and seeds, omega-3 fatty acids from fish, turmeric, ginger, and garlic are thought to have cancer-fighting properties. Some patients also try dietary supplements thought to have anti-cancer effects like curcumin, resveratrol, green tea extract, vitamin D, selenium, and probiotics. More research is still needed, but diet is unlikely to directly target or cure mesothelioma on its own. Herbal remedies are another common alternative treatment option. Some patients use medicinal mushrooms like reishi, turkey tail, or maitake, which are thought to have immune-boosting benefits. Others try mistletoe extracts, which are widely used as a complementary cancer treatment in Europe. Some early research has found mistletoe may help reduce side effects from chemotherapy and improve quality of life. However, it has not been proven to directly treat or cure mesothelioma. Turmeric, ginger, garlic, and holy basil are other herbs sometimes used that have anti-inflammatory and antioxidant properties. As with supplements, more research is still needed on herbal remedies' effectiveness for mesothelioma specifically. Acupuncture is a form of traditional Chinese medicine that involves thin needles inserted at specific points on the body. Some believe it can help reduce side effects from cancer treatments like nausea, pain, fatigue, and support emotional, spiritual well-being. A number of small studies have found acupuncture may help improve symptoms and quality of life for mesothelioma patients, but larger high-quality studies are still limited. Risks are generally minor if done by a licensed acupuncturist. Massage therapy could also help patients coping with mesothelioma. Gentle therapeutic massages may ease pain, reduce stress, anxiety, improve sleep and mobility. Research shows massages help reduce symptoms and side effects for other cancer types and is generally low risk. Yoga, meditation, Tai Chi and Qigong are additional mind-body practices thought to aid relaxation and stress relief, which results in health benefits. Cancer patients often find such practices help them cope mentally and emotionally. Some mesothelioma patients consider hyperthermic intraperitoneal chemotherapy, HIPEC, as a possible treatment option, either instead of or in addition to standard chemo. In HIPEC, a heated chemotherapy drug is directly infused into the abdominal cavity after surgery to try to destroy any remaining cancer cells. Early research suggests it may improve survival rates for some patients with limited peritoneal disease. However, the effectiveness for pleural mesothelioma is less certain and it carries higher postoperative risks than standard chemo. More research is still needed overall. Other alternative approaches tried by some mesothelioma patients, either alone or combined with mainstream therapies, include oxygen therapies, ozone therapy, hyperbaric oxygen therapy, molecular hydrogen therapy, photodynamic therapy, magnet therapy, yoga, Tai Chi, Qigong, guided imagery, cannabis, medical marijuana, and participation in support groups or clinical trials of various natural compounds or experimental drugs. However, very limited research currently exists to prove effectiveness or safety for mesothelioma specifically with most alternative therapies. Open communication with doctors is important for any complementary approaches. While there is no proven alternative cure for mesothelioma at this time, some patients may opt to explore complementary therapies like nutritional changes, herbal medicines, acupuncture or massage for quality of life benefits when used adjunctively with mainstream care. However, Patients should always discuss any alternatives with their healthcare team due to possible risks or interactions, and not rely on alternatives alone without also pursuing standard therapies given limitations of current research. Further high-quality studies are still needed to establish safety and effectiveness of alternatives specifically for mesothelioma. Traditional care involving chemotherapy and surgery typically remains the standard recommended treatment approach according to medical guidelines based on currently available evidence.